Hello, welcome to Care Management Webinar number 4. Today we're going to be talking about communicating with your team. To review, in webinars 1, 2, and 3, we've talked about the collaborative care model. We've talked about the script for that initial telephone call. And just as a reminder, that's our time to begin rapport with our clients. We want to remember etiquette. We want to be that voice of hope for them and be engaging with them from the very beginning. We want to keep track of everything that they say, everything that we talk about, so that's why we have that contact information form, and we're going to use that or some other tracking method that we might have to keep track of when we're going to call them back, because I know you have a lot of clients in your caseload. There's nothing worse than somebody falling through the cracks. So if you don't have a system, consider just a simple shoebox type filing system with months or weeks, whatever your schedule you're in, to call them back, but just to make sure you have that in a central location. Take your notes. We talked about the PHQ-9. That's something that you're going to be doing on a regular basis, and as you do that, not only just collect the information, but use it as an education tool. Each time you go through that with your clients, you're educating them. These are the symptoms of depression. So after a while, they're going to kind of go, okay, I'm not eating the way I used to. I'm losing weight and I'm not on a diet. So they're going to start to pick up on it, and you're working with them on their wellness plan. And so you can see the story coming together. Okay, I need to do something before these symptoms become worse. I'm going to start incorporating and getting back to my pleasurable activities. I'm working too hard. I'm not sleeping right. You're teaching them as you go through this. Okay. We also talked about the treatment plan as a place for them to keep track of what they're doing. Maybe they're taking medications. Maybe they're doing therapy. Maybe they're just waiting to see, whatever. That's a central place for that information to be. You have a copy. They have a copy. Their provider has a copy. The personal wellness plan. This is where we're helping them work through challenges. We're helping them come to a decision that they can live with. We're helping them to think of those pleasurable activities as we get to know them and we're talking with them, and we're helping them come up with some ideas of what to do. And we're keeping track of all the quantitative things on the vital sign worksheet, right? So per date, we're going to capture the score, the PHQ-9 score. We're going to document whether they're participating in that treatment plan or not, or partially. We're going to document whether they're doing anything with their wellness plan. Are they coming up with some pleasure activities in their life? And then lastly, are they attending any therapy sessions? All this helps us to document and give us a visual trend. And again, it's an opportunity for you to teach. It's not just to collect, it's not just to make, we do want to make your life easier, but we want you to use it as a tool so that they can see this visual tool and actually realize that all of this participation is affecting this score so that they can be better co-managers in their care. Okay, next we're going to talk about communicating all of this with the team, right? The collaborative model is more people. It's not just one person, one provider providing to one patient for one problem. There's more of us, and we have more stuff we're looking at, and you're the glue. Most often, you're the glue. You're holding this all together. It's important for you to get together with your peers, with your provider in a way to communicate this information. So some ideas that we have for you. You could conceivably take if you keep this vital sign worksheet in a chart or in a separate location, you could conceivably take that to your meetings if you meet regularly, and I encourage you to meet regularly with your colleagues. You could take that and provide a visual, or you could keep track in a register follow-up log. This is something that you can just play around with, and I'll show you the register follow-up log here. It's simply a list of the caseload that you have, and with maybe the last 3 or 4 dates and PHQ-9 scores. You could do that if that works for you, if you can't take the physical chart with you. When you go through each client, I would imagine that everybody's there and everybody has some contribution to help with each client. It's important to track that because fine to have the conversation, but if you don't have a to-do list, and not only if you don't have the to-do list, but if you don't have someone to follow up to see if it happened, then your work's for naught. So this form that's titled Team Meeting Worksheet allows you to date it at the top. You have a list where you can put all your caseload in. You have your discussion. What needs to happen? Who's going to do it? Who's going to be responsible for it? And by when? And then as the care manager, you can make that your task to follow up to make sure all those things happened and that it got resolved. So again, this is just another idea for you to centralize this so that when 2 weeks down the road something happens and it's like, well, what happened? Well, you have some notes to refer to and you can see that it's followed up. It's similar to that contact information sheet. You don't want to have it written on a piece of paper in a notebook that you left at home that, da-da-da-da-da-da. It's in one place. It's always in that place. Same way you put your keys in the same place all the time. All that stuff is in a central location that you can go through and systematically go through and check and resolve. So this finalizes webinar number 4, and I hope that you're finding our resources helpful. You may have your own style and maybe you can just incorporate bits and pieces, but I hope it's been helpful to you, and thank you for joining us.